I want to make something very clear to you regarding how COVID-19 may impact people's immune systems. When people talk about how COVID-19 may cause immune dysfunction or immune dysregulation, we're not saying that you're getting an immunodeficiency. When we talk about immunodeficiency clinically, we talk about people that either have a primary immune deficiency or a secondary immune deficiency like HIV/AIDS, where people are at risk of having an opportunistic infection. When we talk about COVID-19, there are various studies that suggest that there can be changes to the immune system in terms of how it interacts with different pathogens. In fact, recently I talked about a study about how SARS-CoV-2 in mild cases could lead to changes in your monocytes and how they interact with cold viruses. We still need some real-world evidence to see how COVID-19 is playing out with other infections, and one of those may be with what's going on with this triple-demic. A lot of people have been recently infected with COVID-19, RSV, influenza, and other cold viruses, and so why has that been happening in such a surge that's been occurring a couple months earlier than our usual cold and flu season? Now, we don't fully understand why this triple-demic has been happening, but I have some new data to share with you that may explain part of the reason why some kids have been getting more sick now compared to previously. This paper, published in Pediatrics, which is the main journal from the American Academy of Pediatrics, looked at co-infections of other respiratory viruses amongst children who were in the hospital with COVID-19 prior to the triple-demic. The study period was from March 2020 to February 2022, so this is prior to the triple-demic, and keep in mind that there wasn't a lot of RSV and influenza floating around because people were wearing masks and being more physically distant compared to what we're dealing with currently, but this may give us a glimpse into how COVID-19 can impact kids. What they found was that children under the age of 5 were twice as likely to require increased oxygen support or an ICU admission if they were hospitalized with COVID-19 and happened to have a co-infection with rhinovirus, enterovirus, or RSV compared to those who were infected with COVID-19 alone. In other words, COVID-19 may increase the severity of disease in children who are infected with other respiratory viruses. Prior to the pandemic, children would get co-infected with multiple respiratory viruses all the time, and the question is, does co-infection with other respiratory viruses increase severity of disease compared to just one viral respiratory infection? This meta-analysis suggests that there's no difference. Again, we need more clinical data to be able to come up with more conclusions about this, but there's more and more evidence to suggest that COVID-19 can increase the severity of other diseases. We should be able to learn a lot more within the next 6 to 12 months as we study what has been happening with this triple-demic. So if you're still taking steps to help reduce your chances of getting COVID-19, that's not a bad idea.